Schema Therapy for Complex Trauma. An Integrative Guide to Healing Childhood Trauma and PTSD. By Deva, Maloney, Ventura. And narrated by Madison G. This book is intended for educational and informational purposes only, and is not intended to replace professional medical advice, diagnosis, or treatment. The information contained herein should not be used as a substitute for the advice of an appropriately qualified and licensed physician, mental health professional, or other healthcare provider. The techniques, exercises, and information presented in this book are not intended to create a therapeutic relationship between the reader and the author. Readers experiencing symptoms of trauma, depression, anxiety, or other mental health conditions should consult with qualified mental health professionals for proper assessment and treatment. All names, characters, case studies, and personal stories used throughout this book are created for illustrative purposes only. Any resemblance to actual persons, living or deceased, or actual events is purely coincidental. These composite examples are based on common patterns observed in clinical practice, but do not represent any specific individual's experience or treatment. While the therapeutic techniques and principles described are based on established research and clinical practice, the specific examples and case studies have been created to demonstrate concepts and should not be interpreted as actual case histories. Preface. The path that led me to write this book began 20 years ago in a small community mental health clinic, where I first encountered Sarah, a 34-year-old woman who had survived childhood sexual abuse, neglect, and emotional torment. Sarah had tried multiple therapies, taken various medications, and worked with skilled clinicians, yet she remained trapped in patterns that seemed to defy every treatment approach we offered. Traditional cognitive behavioral therapy helped Sarah identify her distorted thoughts, but the emotional wounds remained raw. Exposure therapy addressed her specific phobias, but new fears emerged like weeds after rain. Medication managed her depression and anxiety symptoms, but the core sense of being fundamentally damaged persisted. Each therapeutic success felt temporary, overshadowed by the return of familiar patterns: self-harm during stress, choosing partners who mirrored her childhood experiences, and an inner voice so harsh it could silence any progress. During those early years of practice, I encountered dozens of clients like Sarah. They carried what we now recognize as complex trauma, not the aftermath of a single terrible event, but the accumulated weight of repeated childhood experiences that shaped their.
Sample complete. Ready to continue?